Welcome to the Inspyre Effect.
Together we're going to unlock a path to a healthier pain-free you.
My name is Leanne.
And my name is Makayley, and today we're going to dive into PRP therapy. So, a lot of questions. I feel like it's not really known. I feel like when I search up PRP therapy, a lot of like esthetician places and like facial beauty places come up, but here we do things a little bit differently. We're more on the regenerative medicine side of things. So I guess first question, starting off just quick, right into it. What is PRP, Miss Leanne?
Well, if you watched our very first podcast episode, we talked about regenerative medicine, and we only really talked about PRP a little bit. But PRP is one of my favorite things to do. As a matter of fact, I feel like it just fixes everything. So PRP is platelet-rich plasma. And what that is your blood carries, obviously, right? It carries the power to heal your body. So whether it's whether you get sick or injured or you cut your arm and it heals, that is your body with its healing factors fixing those things. So what we do in the case of injury, whether it's a fresh injury or one that just won't heal, we can isolate the healing components of your own blood and use it to target those areas that are just having difficulty healing. So what does that look like? I'm assuming is the next question. I didn't even ask you or let you ask, but what that means is we draw your blood. Then, so we just draw it like a normal, like when you go to the doctor or the lab and get your blood drawn. Same thing, nothing fancy about that. We draw it and then we put it in a machine that spins it really, really quickly, really fast, and pulls the red blood cells out of it, leaving the plasma concentrated with the platelets at the top. Then that's what we take out of the tube and use it to inject it into the area that we're trying to heal.
Yes. And I knew all of that this time.
Actually. So the downside is that you kind of already know about PRP, and so it's hard to ask questions that people naturally ask. But when people call here and they ask about PRP, what are some of the kind of questions that they ask or things that they ask about?
Does it hurt? How long does it take? Benefits, risks? I guess kind of just the whole, we'll start with one, not all four. Mm-hmm. But let's go with pain. Okay. So obviously it's a needle being injected. For the knee, there's bones and a bunch of structural things here. So I guess painful is the main question.
Okay, that is a good question because the only way to get it in there obviously is to inject it into that area. So very commonly we do it into the joints, most commonly the knee and the shoulders. Those are my jam. But we also use them in muscle tissue, so like trigger points. We also use it for tendinopathy, so your tennis elbow, things like that. So it depends on what your injury is as to where we'll put it, okay? It is a very small needle, almost the size of an acupuncture needle, very, very small. Regardless of where we're putting it at, it's not a huge needle. Into the joint, obviously, we have to go a little bit deeper than just the top layer of skin. So it is, people are worried about the length of the needle. None of that really matters. As a matter of fact, I won't even show you, or I won't even tell you. I'm just going to tell you to chill out. It's okay. All you're going to feel is like maybe a little prick, and that's it. The most painful part, and I wouldn't even call it painful because I've had it done. So I know, because I needed to experiment to know exactly what are my patients feeling. So I've had it put in almost every joint, just so you know. The biggest thing is the volume of the fluid that we put in causes a little bit of discomfort feeling, because you're filling in the knee gap or the knee joint with a bunch of fluid that wasn't there before. So you might notice some achiness or some pressure. But usually that's the biggest thing that I hear is we do the injection, I'm like, oh, that was it? And then once they're done, it's a little tight. So I have a little technique that I use to kind of help move the fluid around a little bit more so it doesn't feel like you have this trapped bubble of fluid in your knee. And it's very effective. In the shoulder, it's such a big joint, most people don't feel it at all. But in the knee, I would say, and the ankle are the ones that are a little bit more uncomfortable with that pressure. But really that's it. Because we are activating or initiating an inflammatory response that brings those healing factors, you may notice usually that night or the next day a little more achiness, but usually it's never more than what patients are already being seen for. So we have a protocol to help you manage any discomfort, but I usually knock on wood, we don't have any problems. People tolerate it really, really well. I don't know. Hush. It's hollow like wood.
So why would someone need PRP?
So there's many different uses for PRP. Most commonly right now, because regenerative medicine and the concept of non-traditional treatments is kind of new. It's not new, but it's new to people, not the medical world. But it's usually the last resort. I've tried everything. I've already had surgery, or I don't want to have surgery. I've already done PT. It's been years and it's not healing. That's traditionally when we see most people coming in. Is like, I don't know what else to do. So injuries torn meniscus, ligament damage, rotator cuff tears, things like that. But it's more effective if we catch it at the beginning of your injury. So
take the questions right out my mouth.
Well, I'm good at that. I like to talk and predict what you're going to ask so I can keep talking. So no, but that's where we're at is we treat, usually the patients, the most common that we see are patients that have had the injury for a long time, but we're trying to re-educate the world, or I guess educate the world to know your body does its own thing naturally at the initial time of injury, but if you don't rehab it just right, then it's going to take longer to heal, and you're likely going to build up scar tissue and other things that later on can change the way that joint functions. So really we want to get you in as soon as the injury, or as soon as possible after the injury happens, so that we can use our team of experts to help you rehab properly and decide if PRP is right then, or when's the right time to get it in there.
So what are the benefits versus the risks of PRP?
There's really not a whole lot of risks for PRP. I mean, if we look at, it's not FDA approved, so there's no solid studies that say, this helps or doesn't help that are approved and saying, okay, now we can use this on everybody. It's more of anecdotally, right? There are no studies, or very few, none that I know of, that says PRP is harmful. Okay, if anything, maybe neutral, but most people report an improvement in their symptoms. But there's really no risk other than the procedure itself. So whether you got a steroid injection in your knee or your shoulder, or whether you got a gel injection, it's the same risks involved because we are using your own body's products. There's no risk for rejection, and it's just the same thing. Bleeding, bruising, things like that are pretty much the only risk. Oh, infection. But we clean really good. We have good techniques that we use and have 0 complications reported so far in the years that I've been doing it.
Okay, good. The next question is, in the body, you could do PRP. You said joints, but where most commonly do you see PRP needing to be injected?
Most commonly knees and shoulders, just because, like I said, people come and have arthritis or they have specific injuries. But remember, the knee, unless it's just arthritis, and it's usually not just arthritis, there's issues going on usually above and below the joint, which is why it's important, which makes us different with most other places that you can go to get these things, is because we don't just look at the knee. You have knee pain? Okay, let's inject into the knee, have a good day. Something else is triggering that, and usually it's something above or below the joint. So usually your knee pain is coming from, unless you had like a direct injury where you know exactly what happened, it's usually ankle or hip or even low back issues. So we look at the whole thing. So sometimes when we inject into the knee, we also find other things like trigger points in the quads or the hamstrings, or issues with hip mobility, and we work to help solve those problems as well. So the PRP will help fix the damage that is caused and help minimize pain, but the overall treatment for the problem itself is going to be addressing those other issues. And so that's where we see, when we talk about knee PRP, it's not just the knee. That is the most common that we have. Shoulder, most of the time, you're coming, unless you know that you have a shoulder injury because of an injury like what they call a slap tear or a labral tear that we see a lot with baseball players, things like that, then a lot of times it could just be coming from the neck, or we've created what we call trigger points. Trigger points that we've talked about previously are just really tight muscles that have basically been glued like that. And so when you take a muscle and you shorten it and you glue it into a certain position, it doesn't move like it should, and it's going to create problems for the things that that muscle is attached to. So if you have a trigger point here, it can cause neck pain, which can cause headaches, or it can cause shoulder mobility problems, which makes you think that you actually have a shoulder issue. Does that make sense? So just coming to me and saying, my shoulder hurts, can I do PRP? It's not that easy. We're going to dig into that and try to figure out exactly why you have shoulder pain. Other places, so trigger points is probably one of my favorite places to do it, because a lot of the patients that come in with trigger points have had this chronic pain for so long, and we can do trigger point therapy and it helps, but they have these residual ones. They just keep coming back no matter what they do. One, if you're consistent with your rehab exercises, we can usually eliminate the pain from these. But if you really want to get in and you've got this, knot in your back that just never goes away no matter what you do, yes, that is where we can use PRP into helping heal that one. So you asked where else we can use it, most commonly knees, shoulders, but PRP, I put it on everything. It can go anywhere on everything. The only thing that's different is the technique and kind of what we're trying to treat.
You said that like it was a condiment.
Well, that's what I was thinking. What is that, Frank's Red Hot? I put that shit on everything.
For PRP specifically, can you inject my platelets?
Into you?
No, into you.
No.
It has to be your own.
Yeah. So PRP is a blood product, and your blood products, anything I take out of your body is specific to you, and I cannot put it into me unless we were a match. Meaning that all of our markers were the same. So when you have somebody who is a donor, like a kidney donor, somebody needs a liver transplant, they have to match up perfectly so they minimize the risk of rejection. So anytime, if you take something from somebody else and put it in your body recognizes that as like a foreign invader, and it will start doing things to reject it and get it out. You'll get really sick and it causes lots of problems. So that's why with PRP, you only use your own product to help yourself. Now what I hear sometimes is like, well, it's my blood. I already have it circulating in my body. Why is taking it out and putting it back in going to do anything, right? So what happens is when we have an injury, I'm going to use I love to use the analogy or the example of ankle sprain, a sprinkle. Sprained ankle, sprinkle is when you sprain your ankle, and I choose that one because it's so common and it's easy to visualize. You sprain your ankle, it hurts, you may or may not be able to walk on it, and this swelling that happens, right? All that swelling is your body, so your body recognizes that there's an injury and it releases certain triggers that tell your brain, send down the fixers. So they send the cells down through your plasma that's going to help heal that area. Depending on the extent of the injury is how swollen it gets. Also, how quickly it'll return back to normal. So this is where it's really important that you come in and see us quickly, because in the example of your ankle, you have lots of ligaments and lots of other structures in that joint. If they don't heal properly, your body is basically going to stabilize that joint and deposit like scar tissue and things like that. Scar tissue doesn't move like your regular tissue does. So that means you're going to limit your range of motion. It may not be right now, but 2 or 3 years from now, you're going to wonder why your knee hurts. But it's probably because you have limited ankle range of motion because you didn't heal properly 2 years ago when you sprained your ankle, if that makes sense. So anyways, that initial inflammatory response is what we're initiating with the PRP. So if that ankle never really healed and it's always kind of bothering you, your body's constantly trying to fix it. But it's kind of like the boy who cried wolf. Like, there's only so long, your body's gonna be like, you know what, I'm tired of messing with that ankle, let's just start, we have other things to worry about. Yeah. So the response isn't going to be as big and trying to fix it. So what we're doing by isolating the healing components and injecting it into that area again, is we're restarting that inflammatory response. Not only that, but especially in the cases of joints like your knees and your shoulders, the blood supply, it's really good. The muscles heal quickly, but the blood supply or your blood vessels don't really get as deep down into that. That means that the joint structures, the ligaments, the tendons, things like that are going to take longer to heal. So what we're doing is we're basically just taking the stuff it needs to heal and just dumping it right into that joint. So it's going to help improve that process, that healing process. Sorry, just nerded out. I even forgot what the question was.
It's okay. After PRP injections, what does recovery time look like?
That's a good question. It also depends on where you are in your injury. It's really important. So first of all, I want to rewind a little bit. PRP is usually not just one injection. It also depends on how old the injury is. And if you think about PRP, is we're using it to kind of help break up scar tissue and stuff like that. The older the injury, the more you're going to need as far as treatment goes. And with that being said, that inflammatory response that I was talking about before usually lasts 5 to 14 days, depending on the extent of the injury and your body and how it heals things. So that's why we do the injection, and then 2 weeks later we do it again, and then right when the body is starting to like slow down the healing process, we do it again. So our protocol consists of typically 3 injections separated by about 2 weeks in between. Okay, during that time you can do normal activities, you can go to work, you can exercise, you can do all those things. Each person's recovery time and rehab plan is going to be individualized and a little bit different. So it really depends on the extent of your injury. But that's why we pair with the chiropractors and the rehab, the physical therapist to get the rehab going, because that's going to be a huge part in how you recover. That starts right away. So we're going to have you exercising. If you have an event coming up, a competition, we'll work with you to get you back to that competition level as soon as possible with minimal downtime.
Cool. From time of injury to time of feeling great, done, there's injury, treatment plan, treatment, recovery. I just want to go through from beginning to end, and then with the possibility of re-injury anytime in between that. Does that make sense?
So I guess what I'm hearing you ask is like, from the time I hurt myself, what happens and how many times we'll have to come and what's that going to look like? So you want me to kind of like a timeline?
Yeah, like a timeline of...
Okay. So let's say you injured your shoulder. You had some shoulder pain with an actual exercise. Like you remember it happened. Okay, so it happened 2 days ago. It does not feel good, Leanne. I'm not sure what to do. So you book an appointment with us. You come into the clinic. We do a full exam and trying to find out exactly what that specific injury is and what could have contributed to it. Okay. Then if PRP is the right fit for you, we can start that day. There are some limiting factors into starting right away. So one is if you've been taking a bunch of anti-inflammatories, things like that, we want you to not have suppressed your the way that your body responds to injuries at all. And ibuprofen, Aleve, things like that can do that. So if you're taking it once or twice, not a big deal. But if we're taking it every day for a while, we want to wait and let that clear out the system. So I give it, a couple days to maybe a week. But if you start that day, we can start right away. We draw the blood, we do the treatment that day. Then maybe within that week, so 3 to 7 days later, you're going to do your first physical therapy session with the physical therapist here in our office. It's going to tailor your treatment based on what we are actually doing. And so after that, then you'll see them again the next week. So every week you're doing something, whether it's injections, PT, or chiro, something like that. Depending, like I said, on your injury, but every week we're doing something. Usually that process is 6 to 8 weeks. Okay, if you just injured it, it's a brand new injury, you're not likely to have it again, and you're fairly healthy, we may need to only do 2 injections. So that's why I say the treatment plan can vary. But yeah, so that's what that looks like. At the end of that treatment, that's 6 to 8 weeks, depending on how you're feeling and what your goals are will determine what's going to happen in the weeks and months after. Most people were really good. Like just because the last injection's done does not mean, okay, this is it all that I'm going to healing. It continues to work and has been shown to continue to improve your pain and range of motion up to 6 months. So that's why we do, after we're done, after the last injection, I do a 6-week follow-up with you. Bring you back in, let's do another exam, let's see how you're feeling. We'll determine, do we need to do more, or do we need to continue PT, or do we need to do something different? We have lots of different modalities that we use. So it just really depends on your case. everything's good, then usually I do a 6-month follow-up. At that 6 months, same thing, see how it's healing. To be honest, I don't hear from people at the 6-month follow-up. I have to do better at following up. You know, I mean, I at least do a phone call. I would like for them to come in so I can do an exam and really compare from when we started till then. But a lot of the times they're like, no, I'm good, I don't need to come in. And so that's good, right? Because they're healed and they're doing better. But I would like to, you know, be more consistent in that so I can have some measurable data from my point of view. You, with any injury, you're at a higher risk of redoing that, of like repeating that injury, if you don't change what caused the injury in the first place. So if you're exercising and you have poor form, we fix you and you go back to that poor form, you're going to injure yourself again. So that's why the treatment, during the treatment period, the rehab and all the other things are so important to identify why and minimize the chance of re-injury.
So why don't we use this table? So we have a table here today instead of our normal chairs. She wanted to fill me up. I'm just kidding.
My daughter-in-law knows.
So we kind of wanted to go over, do you want to do like, show them like what it would look like, an ultrasound, stretching, kind of like movement to minimize that post-injection discomfort? I don't know, what do you want to start with?
I think the idea with us having the table instead of the chairs is because when we're talking about injuries, it's really important to know that there's more than just where you're having the pain. What is actually your pain generator and the cause? So really just walking through like maybe a knee exam, you know, not in detail, I don't want to bore anybody to death, but just kind of give you an idea. So when you first come into the clinic and let's say you have, we'll do knee pain and then we'll do shoulder pain, okay? When you have knee pain, some of the typical questions that I ask is, where is your pain? What causes it? What makes it better? What makes it worse? What are you taking to manage your pain? Have you ever injured it before? Have you had any surgeries? What medications are you on? Because that can affect a lot of different things, medical problems that you have. So people who have like diabetes and stuff like that have a lot harder healing than most people, a harder time healing than most people. So those are all important things that I ask because they can play into our plan to repair or to fix it. So let's just say I ask you where your knee pain is, and let's say you say it's on, pick a spot, on the inside, okay? So then I'll go through and explain to you what the knee looks like. I'll do an exam first, but then explain to you like the different parts of the knee and how they're attached, so you really understand how everything else plays into it. So like say if you're having some medial knee pain, there's so many things that can be. If you didn't have an injury, it may not be a meniscus injury, but that's when I go in and looking up here. So we're looking at if you do you ever have any pain in your quads? You know, and sometimes you have pain here, sometimes, most of the time what we have is pain on the outer side here that affects the outer knee. So we have trigger points all up and down both of these, your legs. And so that's what I'll do is I'll have an exam to do that. Then I look at not only your range of motion for your knee, but also your hip. So if we want to go ahead and lay down for me with your head at this end. So some of the things I do, one is just checking range of motion. So I'm going to act like I need you to pretend you're dead. Let me have control over your legs. So the first thing I do is just really kind of moving around, seeing if I can feel any clicking, popping, anything like that, any restriction. Then I also move, remember we're looking at the knee, but we're also looking at the hip. So if I notice any issues at the hip, then that's something that we're going to talk about some more too. Then we checking stability of the knee, of the hip, seeing if there's any pain with certain movements and rotations, things like that. The other thing is really getting into the muscles here and feeling down. So, you know, when we go through this way, she's going to get a free massage, but she laughs at everything. So, but if you have trigger points here that are really, really tight, they can actually pull on the knee. So your knee pain might not actually be from the knee joint, but maybe from here. Well, why would we develop trigger points here? Do we have hip mobility issues? Is our form, you know, as far as our knees and our ankles, everything else when we're squatting and we're exercising, is that causing any issues? So that's why I think it's important to really talk about you're having knee pain, but really what else is going on. The same thing.
Could it be my ankle?
Absolutely could be your ankle. So in the case like we were talking about earlier with ankle pain, you sprain your ankle. I think you've sprained your ankles a little bit.
Yes. Very
and
clumsy.
so if you don't rehab these just right, like I said, then if you don't have good range of motion of your ankle, then your knee and your hips are going to have to make up for that range of motion depending on the activity that you're doing. So there's only so long that that's going to work without some type of issue. So sometimes your knee pain is from your ankle. So depending on what we find in the exam is what we tailor our treatment to. Okay, let me show you for, go ahead and sit up for me. Again, talking about shoulder pain, some of the things I'll do is checking shoulder range of motion. But really, like I said, shoulder range of motion is not hard to check. We have the patient move their arm in different directions. Put your arm behind your back like you want to scratch your shoulder blade. Yeah, so we look at how easy that is, how high can they go. Go ahead to put that one back down and do the other side for me.
Oh, this one's
Yeah, so she definitely
bad.
has some limited range of motion on the left side. Do you ever have shoulder pain?
Yeah.
Yeah?
I have
Do you ever
pain
have neck
everywhere.
pain?
She's probing me.
What side is your neck pain usually on?
It's worse on this side, but it is on both sides. This one I still have like a little. This one I have a knot right here too. I have knots all from my neck down to my shoulders.
Yes, but just so you know, we are working
Yeah.
on that with her. So, but I just the example I'm trying to hit on is your decreased shoulder range of motion is on the left side, but that's where most of your pain is as well in your neck. So a lot of that could be connected. So all those tight muscles, those knots that she's talking about, can be causing limitations in a range of motion. So who cares if you can scratch your back, right? Like who cares if you can't put your shoulder, touch your hand to your shoulder blade? Well, right now it may not matter, but later on as you get older, it will. When you're trying to put your bra on, those of us who need them. When you're trying to pick up stuff out of the back seat of the car, carry your kid around, all of those things can really play into effect. But that's why we look at not just the shoulder, but also the neck, even the upper back muscles and things like that.
Should I face the other way so you can see you touching my back?
Oh, no, that's good enough. That's all. I don't know. I didn't really want to spend a lot of time doing an actual exam. We can, in the future, do that if you want to. We can like spend some time and actually show what a shoulder exam looks like. But just for general purposes, I just kind of wanted to show that we don't just look at where you say it hurts. We look at the whole picture, and that's what I think is important.
Do you think anything else is important?
Yes, I think it's important that when you plan a podcast, that you know what questions you want to ask.
I forgot to look them up.
That's okay. No, I know for real. I do like the general kind of just conversation. It doesn't have to have planned questions, but
Well, yeah, and I've been trying to think about it through the fact of like, if I am in pain and I'm coming to you, what questions would I have? And when you're trying, I already know a lot about PRP, but if I feel like since I know a lot about it, I have more in-depth questions about things. So,
you know that brings up a good point.
done?
What?
You should ask me these questions and see how well I could answer them.
That's what we'll do. Quizzes.
Quiz.
Yes.
Yeah, I'm gonna quiz the dummy.
Let's talk about kind of what I see and kind of where my dilemma is with patients, with friends, families, things like that. Okay. I know that we can fix you or your problem or whatever, your knee pain, your shoulder pain, whatever it is. Back pain, especially back pain, is super complicated, but it is definitely almost every time a way that we can fix you without surgery or pain medications. I mean, with all of these things. But with anything, it takes time. But what I see a lot is you injure your knee or you don't, it's just hurting. It doesn't stop 3, 4, 5 weeks in. It hurts after you've ridden your bike for several hours or something like that. Then I see people posting, oh, I'm at my doctor, they ordered an MRI, I might have to have surgery. Well, I personally know that these people have only been, hurting for a couple of, let's say, less than 2 weeks or something like that. Usually, I'm sorry, I said 2 weeks, I mean like 2 months. And so it is persistent for them, but they haven't done any PT. They haven't done anything else. They go straight for the MRI, straight for what the insurance is gonna cover. Steroid injections into the knee or into the shoulder, things like that. They may give you temporary relief, and you may know what's going on, so you have a torn meniscus, but then they feel either stuck, they don't know what to do, or they think that's the only option is to go through surgery or go through these injections and things like that. So we can help people heal without the use of steroids. Steroids do have their time and their place, but it's usually used way too easily and way too soon. They also cause tissue to the damage to the tissue around it. So when you're injecting into the knee, you're causing damage, future damage to the bone and the supporting ligaments. So that's why when you go get these injections, they usually tell you, oh, we can only do this once or twice a year, or we can only do this so many times, then you got to have surgery because it doesn't work anymore. Well, because we're not looking at the whole picture. We're not looking at the only thing. So can you fix the knee even without PRP? Absolutely. PRP is just going to speed up the process in which it happens, and partly not just because of the PRP, but also because of the therapies that we do. So I want to say to people, if you feel like you need to use your insurance, I completely understand. You pay for something every month and every year, and you want to be able to utilize it, but they tell us what we can and can't do, and they don't utilize alternative options. It's always going to be injections of steroids or give you some pain medicine or surgery. Sometimes you'll get lucky and get prescribed physical therapy, and you go to traditional physical therapy places where they have maybe 2 patients at the same time, or they're just really, really busy, so you don't get your full hour and just kind of feel like a mouse or a hamster on a wheel, right? And I think that's where the biggest difference is that here we do physical therapy, we do that stuff, but it's a one-on-one for the full hour. You get a full, there's nobody else that does it like that. So I think that is what is so important, and why you can go get your MRI and your x-rays from your primary care, but then come see us. Yeah,
and I feel like that's what you just said really sums us up as Inspyre. And I kind of have to question what all started Inspyre for you?
So that is a loaded question, to be honest. There's multiple reasons. I didn't start off going Inspyre because of this, but I've been in the ER for 20-something years and seeing people come in for back pain over and over and over, and it's just a standard protocol. Here's your muscle relaxer, here's your steroid shot, maybe some steroids to take at home, ibuprofen, go see your primary care, kind of thing. They may or may not do an x-ray. Definitely not going to do an MRI unless you can't walk or there's some kind of neurologic thing. But I see people come in and they leave still in pain. And I guess over time you start to think about there's got to be a better way. Same thing, people in car wrecks. Personally, someone close to me in a car wreck when I was younger. I don't know all the details of it because I was younger, but all I know is that it affected us as a family because of pain medications, chronic pain, inability to do things as a family because of the pain and the restrictions that it caused. And I just feel like it was handled in a way, there had to be another way. So I think that's why Inspyre is here, is because I found other ways, right? And that is what I'm trying to do, is continue that and educate people that there are other ways. You don't have to take those medications daily. Now, is it going to be easy? No. You still have to put in your work. But we're here to help you do that and do it in the most efficient way possible. It's still going to take some time, honestly. People want a quick fix. If you want a quick fix, we're not the right one for you. We're not going to give you pain medicines. We're not just going to give you steroid shots. We're here to help identify the cause and fix it. So,
PRP therapy. Are there any cliff notes you want to go over?
So let's just kind of summarize. PRP is your own body's ability to heal itself. We're isolating that in that plasma. That's what PRP is.
Platelet-rich plasma, the clear stuff.
Yes, yellow. It's golden yellow. It's
that little scab when it forms on there. It's that little crusty stuff. That's how I knew what it was when I first started working here. You scrape your knee and the clear stuff forms over it after you're done bleeding.
Well, that is definitely your body sending those healing factors down there to fix it.
I got a lot of falls and bikes.
It's a very complicated process and very tiered process, but that's the way to kind of summarize it just easily. It's like your body can heal itself. Sometimes it just needs some extra help and some guidance in order to expedite that healing. And it's never just about one part of the body. We've got to look at all aspects of it, and I think that's probably the other biggest thing to look at is when you come to us, we're not just looking at your knee. We've got to look at the whole picture. Minimal downtime.
You can leave the same
Great.
day.
Yeah, I mean, obviously, we're not having you stay here. I'm trying to go home, so you're not staying the night
Not
here.
your house.
Yeah, but I mean, from the time you walk into the door, if I've never met you before, you can walk in the door and out within an hour, hour and a half with a treatment if you decide to do it the same day. If we decide to do a therapy, which we don't usually do on the same day, that is a possibility, but usually a couple days later. But with that being said, that's kind of the treatment, like that's the questions that we have is like, how fast can I get in? How fast can I get out? What's my recovery time? The other thing is financial, right? How much is this going to cost me? Or we have packages, and we do that for a reason. One is we want to save you some money, but we want you to be consistent with your therapy. You have better outcomes when you do what we tell you to do. So we're going to try to incentivize you and be like, yeah, I already paid Leanne, I'm going. So that's really the reason behind that, is because we need you to come. We need you to finish your treatment plan so you have better outcomes, so that 6 months, 12 months, whatever it is from now, you don't have a reoccurrence of that injury because you did what you were supposed to do. So we also offer financing. So really there's really no reason not to do it. And right now, I don't know when this is going to air in relation to what we're offering, but we are offering right now, if you come in for a consultation with me and you decide to move forward with your package, we waive the consultation fee. We're just trying to find any way that we can to help you get the treatment that you need and start your therapy as soon as possible.
Merry Christmas.
And if you're watching this in July, Merry Christmas anyways.
Thank you all for watching. Sincerely, from the bottom of our hearts, all 21 viewers on the first episode and all 13 viewers on the second episode. Let's amp it up, maybe double it, or just add them up. But we are just doing this to educate. You know, like she said, a lot of people are in pain, get addicted to pain meds, and we're just here to offer you an alternative solution. Like, there are so many other ways, just a quick Google search or just watch the video. All of them. We talk about so many good educational things, and I think we just want people to not be in pain and to not fall down that hole of pain med surgery.
Yes. And I think it's hard traditionally for us to think outside the box.
Yeah.
As patients, you know, wondering, what am I going to do now? What can I do? And that's what we're here for. And so if you're not sure what you can do, then schedule a consultation and we will help you figure that out. Yeah. We want you to feel better so you can live better.